Have you been putting up with that uncomfortable twinge in the shoulder for some time now? This could be what's going on in your shoulder, a condition called impingement and rotator cuff tear. Let's take a closer look. The acromion forms a bony arc over a tight space above the shoulder joint, in which the rotator cuff tendon travels through. Over time, bone spurs were formed under the acromion, putting pressure on the rotator cuff tendon underneath. The tendon is pinched under the acromion, particularly during overhead shoulder movement. This ongoing rubbing on the tendon creates a tear. Further repetitive injuries cause the rotator cuff tendon to thin out and eventually rupture and detach. These injuries of the tendon can be very painful, not only from the tendon itself, but also inflammation of the bursa, which acts as a soft cushion right above the tendon, causing bursitis. This gives us a constant ache over the front and the top of the shoulder. The pain is made worse with any movement that place our arms above our head. As the bone spur digs further into the tear, the shoulder also feels very weak in overhead activities.
It is also painful to put arm around our back, such as dressing ourselves, or even wiping ourselves in the toilet. When the inflammation gets worse, the shoulder becomes so irritable that lying on it at night can wake us up with pain, and we can no longer enjoy a good night's sleep. During examination, the doctor palpates the shoulder starting from clavicle to collarbone. Here the doctor feels for any pain over the AC joint that joins the clavicle to the acromion. The doctor then feels for the typical painful area around the front of the acromion and the bursa underneath. Next, around the side of the acromion, the rotator cuff tendon insertion is felt for any tenderness. The patient is then asked to go through some movement, such as taking both arms all the way up and look for pain during this movement. Here, this patient shows signs of a painful arc as he tries to bring both arms up from the side. The right shoulder is slow to move halfway up due to pain. The patient now tries to bring the arm around the back. Notice the right shoulder struggle to move up due to pain. The patient was then asked to stretch the arms out to the side. This movement is often normal with this condition. The sore right shoulder shows the biceps muscle in a slightly lower position at the elbow. This can be related to full tear of the rotator cuff. Next, we will demonstrate an example of weakness in one of the rotator cuff tendons. The affected right shoulder is too weak to push back the doctor's hand. When the hand is helped to lift off his back, the right shoulder is too weak to sustain. X-rays sometimes show calcium deposit at the area of the tear, known as calcific tendinitis. This MRI scan shows a rotator cuff tendon before and after tear, with tendon pulled back from its insertion. Rotator cuff tear is a disabling condition that gets worse over time. This condition deserves your attention to begin treatment early. Pain medications, particularly anti-inflammatories, are useful to reduce discomfort. It's also helpful to rest the shoulder in the sling for the first 2 weeks for pain relief. After the initial rest, pendulum exercise is a good way to gently rehabilitate the shoulder. Cortisone injection can be placed into the bursa and around the tendon tear to help reduce pain and inflammation. This is usually done from the back of the shoulder. The spine of the shoulder blade and the acromion can be easily felt and marked out. I aim for a soft spot 2 cm inwards from the acromion and 3 cm below the spine to place the injection, with needle facing slightly upwards into the bursa. This is an effective treatment to reduce pain, but does not help to heal the tendon tear. Further treatment with physiotherapy is essential. Physiotherapy focus on strengthen other muscle group around the shoulder while minimize stress on the injured tendon. Surgery is indicated if there is ongoing pain and weakness. The aim of surgery is to remove the bone spurs and the inflamed bursa, as well as repair the rotator cuff tear. Rotator cuff surgery is mostly done through keyholes. A camera is introduced into the space under the acromion and above the rotator cuff tear. Several anchors are placed into the insertion of the torn tendon, with sutures from the anchor to grasp onto the tendon to repair it back on. I hope you enjoyed this video. Please leave comments below and check out other interesting videos in my channel.